Now, it's not often you get to ask the experts questions, but tonight we're doing just that, thanks to Bowel Cancer West, bringing together 3 of the Southwest's top colorectal surgeons. Why are we doing this? Well, because the coronavirus pandemic is affecting all of our lives in one way or another. But life does go on, and so does cancer. With fewer people attending hospitals for treatment and investigations, I think there is a real fear that diagnosis and potentially life-saving surgery may be being delayed. So we're here to help, basically, and answer a few questions in a fairly informal setting, but with a lot of information in there as well. So hopefully it may answer a few questions and allay some fears, if indeed people do have those fears. So first of all, I'd like to introduce you to Mark Coleman from Plymouth's Derriford Hospital in Plymouth, Paul Lidder from the Royal Cornwall Hospital in Truro, and last but not least, Neil Smart from the Royal Devon and Exeter Hospital. Welcome to all 3 of you. Let's first start, before we launch into specific questions about bowel cancer, diagnosis and treatment. I think the question on many people's lips at the moment is it safe to come to hospital at all, given the present circumstances? And Mark, if we can start with you first of all in Derriford Hospital, just briefly tell us about the situation there at the current time.
Yes, thank you, Victoria, and thanks for organising this event with us. I've been in and out of the hospital at Derriford for the last month during the entire lockdown period, and I have to say, it feels personally a very safe place for me to be as a member of the public and a professional. For example, when you go in, there are separate zones for entering the hospital, leaving the hospital. In all critical areas, people are being clinically screened by having their temperatures taken, and care is being provided to patients both with COVID and without COVID. And thanks to the NHS and the government, we have very good guidelines, and our trusts are giving us very good steer as to how we go forward in terms of dealing with COVID and carrying on as normally as we can in very challenging circumstances.
Mark, thank you. Paul, is it the same at the RCHT? I mean, you can probably understand why people would be quite nervous about coming into hospitals at the moment.
Yeah, I think the hospitals really embrace the guidance, and we have got PPE locally. We've tried right from the outset to establish green areas and red areas. Obviously, the red areas are those patients that are experiencing, or we have a suspicion that they might have symptoms of COVID-19. But we are trying to run as much of an elective service as is possible to support those patients with urgent conditions, particularly those with cancers. And we have some very clearly established green areas. I think it's very much a different experience for patients attending for their elective operations, in the sense of the additional steps that patients have to go through, both in the pre-admission screening questions and when they arrive on the wards. There's the social distancing, there's having the temperatures checked, there's wearing face masks. So I think if people previously found visiting a hospital a bit intimidating, it's probably more so, not because it's a dangerous place, but because it's just unfamiliar with staff wearing gowns, aprons, face masks, and a restriction on visitors as well, accompanying most patients.
So a little bit more involved for the patients, but it's all for the health and safety of everybody there. And Neil, is it the same at the RD&E?
It is. Just like to echo the points that both Mark and Paul have made. I think the systems and processes that have been set up by the hospital in line with the government recommendations have been very good. They've worked well. We've got the ability to screen patients immediately before they come into hospital to make sure that when they're coming in, we know that they're likely to be COVID negative. Anyone who's found to be positive, we tend to suggest rearranging their operation for safety's sake. We've got ring-fenced areas. We've got plenty of PPE. I've not needed hunt around for any. It's all been readily available. And again, for those patients who need to be here, they shouldn't have any concerns or worries about coming in and getting the appropriate treatment that they need.
Thank you for that. We heard in the news recently from Dr. Michael Marsh, who's Medical Director for NHS England here in the Southwest, and he was saying that hospitals have been scaling back diagnostics, but that's about to get back on track again. So this must be very welcome news. Neil, if you'd like to comment on that first of all.
Yeah, I think there's been some changes because of the COVID-19 situation, and we felt that we couldn't carry on safely with the level of colonoscopy. That's the camera test that goes up the bottom to have a look around and to check the lining of the bowel. And so nationally, there've been moves to scale that back. But I think that there are alternatives that we have in terms of investigations that we can do. And locally, we have some of those available. So one is a bowel test that we can do where we take a bit of poo and just check to see if there's any blood in it, which is called a Q-Fit test, available at some GPs, and we do have some tests available in the hospital, send out to patients who have the appropriate symptoms. And we still have the CT scanner available, which is working, which is very good for investigation, very good for investigating some patients, particularly those who are more elderly, more frail. So we still have options up our sleeve. You know, not everything has stopped completely. So patients who need to be investigated, we can still do it.
So you're finding ways and means to continue that treatment and investigations. Mark, if someone is undergoing chemotherapy, this is a question that many people are asking. Do they continue with that chemotherapy? Because of course we've heard about the very many fears that it could make someone more vulnerable to coronavirus, but then treating the cancer is also incredibly important to carry on that treatment. So
yes, and that's a really important question. Our oncology colleagues who deal with chemotherapy and radiotherapy, once a course of treatment has been started, are maintaining that course of treatment, but obviously probably uplifting the rigor with which they observe their patients to make sure there are no signs of things like COVID infection, and also distancing, shielding, isolating people having chemotherapy to a greater degree than the normal population. What we've done in Plymouth is they've effectively formed a relationship to take over a good chunk of the Plymouth Nuffield Hospital, so they can take these patients off site to further reduce the risk of any possibility of them getting COVID. So they can park, go to have their chemotherapy, go home without coming onto the Derriford site. And that will continue for the foreseeable future until it's seen as safe for them to return to the hospital. We are looking at the indications where new patients might be considered in need of having chemotherapy. And you have to balance those risks against the benefits and against the obvious fact that if you're having chemotherapy and you're unlucky enough to get COVID, the outlook is probably very poor. So you have to sort of make a new calculation for the risks and benefits to say, is it still a good idea to have chemotherapy? Or even in some situations, and in some cases it can be delayed for a few weeks or months and still have some benefits. So it's a complex thing, not just affecting bowel cancer, but other cancers. But I think certainly in Plymouth there's a good system.
Paul, we've spoken before where you're sitting now, actually, probably about the signs and symptoms of bowel cancer. For those who haven't been diagnosed, for those who are probably sitting at home now, too frightened to either pick the phone to their GP or hospital because of the current situation, what would your message be to anybody at home at the moment who may be detecting some of the initial signs? What's their first port of call?
Well, I think it's important to remember that particularly with cancer services, all throughout the pandemic, we've been maintaining a service. So that service has never stopped for those patients with suspected cancers. I think the first port of call would again be to contact your GP. We still have a 2-week wait referral service running. A lot of those patients now will be managed in a virtual consultation. Certainly in Cornwall, the vast majority of those consultations will be undertaken over the telephone. We already had a virtual consultation service well established prior to the pandemic. That's just been widened and rolled out to cover a greater number of people. So a nurse specialist would go through the consultation following a referral and would stream patients to an appropriate test. to mirror what Neil Smart had said at RD&E, we don't have the same capacity to deliver all of those investigative tests as we previously did, but we have realigned some of our pathways to divert patients to the fecal testing. We still in Cornwall are providing colonoscopies or CT scans. So various algorithms have been drawn up, but essentially the most important thing for patients to realise is that there is a service still running. If they've got symptoms, they should see their GPs about them. And we are open for business. The GP should be referring these patients. We did see a significant drop-off at the start of the pandemic, and our organisation saw about an 80% reduction in 2-week wait referrals across all cancer sites. We've begun to see a recovery in that. In the last week, it's gone back up to about 50% of where we are. So I think people are beginning to seek help, but clearly we've still got a long way to go before we get back to the levels of patients that we were seeing prior to the lockdown.
Neil, we hear about stretched services and capacity, but again, you probably will echo that message from Paul Lidder there in Cornwall, that you are very much open for business at the RD&E.
Oh, very much so. And patients who need either emergency treatment for their bowel cancer, they can still get it. People who need the appropriate diagnostic, there's lots that we still can do. And for the patients who need treatment for their bowel cancer, they can still get it. The reason I'm dressed like this is because I've been doing bowel cancer surgery today. So, we're very much open for business.
Mark, if I can just finally come back out, who died of bowel cancer 4 years ago, I don't like to think of anybody going through what he went through. So just a final message for you, for anybody sitting at home at the moment during this pandemic, and they suspect that they may have symptoms or they don't know whether to go ahead with treatment, your message to them.
So yeah, if you're on a pathway for treatment and you're worried about waiting time, for example, if you have the contact number for your specialist nurse, do give them a ring, or your consultant, give them a ring. Ditto for the oncology department. So if you're on a pathway, don't just sit there and wait. And you'll find, for example, we've flexed up to 80% of our previous capacity this week for doing our major surgery. If you are worried about symptoms, as Paul and Neil have said, ring your GP, because they will also have a very robust telephone service that will lead you into a 2-week wait pathway, that will also result in a telephone call and investigation that's appropriate to the urgency. And also, if you're diagnosed with bowel cancer, if you have to wait another 2 or 3 weeks, in the vast majority of cases, it won't make a significant negative difference to your outcome, and we will get you treated as soon as possible. If you're worried about more urgent symptoms, again, contact us. We do have emergency pathways, as Neil has alluded to, that we can look after you, and that's what we want to do. We're waiting and ready.
And you all seem like very approachable people, so thank you very much. And don't forget, as a charity, we are here to answer your questions 365 days of the year. All you need to do is email us at info@bowelcancerwest.com. It's completely confidential, but the experts will answer your questions.